today. All right. Well, thank you all again for joining us. My name is Catherine Daria, and I am the Volunteer and Training Coordinator here at Sacramento Steps Forward. Quick disclaimer, today's session is recorded and will be made available on demand for on-demand access on our website afterwards. We'd like to remind you to help us maintain client confidentiality today. And so please, we ask that you refrain from using any personally identifiable information when asking questions or offering examples in chat or verbally. And for those of you who don't know as well, Sacramento Steps Forward is the lead agency for the Sacramento COC, which is the regional planning body for that that coordinates housing and services for homeless families and individuals here in this area. Our core services are listed here below. And one of our roles is to offer these trainings that align both with HUD requirements, and we're also working to ensure that we're addressing the requests and the needs of our outreach staff. Today, we'll introduce you to SSI, Ombudsman, and the medical and Medicare programs available to individuals and or families experiencing homelessness. This includes discussing program eligibility requirements and how to engage people about these offerings. We'll also talk about the impact of COVID-19 on these program operations and the participation in these services. Then we'll also have a Q&A and break after our SSI portion. And then throughout the presentations, you're welcome to share resources in chat or ask questions, which we'll plan to address during our Q&A. Now I would like to introduce today's featured guest. We have Wanda Gonzalez, who is the Northern California Public Affairs Specialist for the Social Security Administration. She is responsible for education and outreach and is available to give SSI workshops, host booths, and more. Wanda has a passion for helping people, the well-being of the community, and finds volunteering opportunities most rewarding. Lisa Coleman was introduced into the world of older adult advocacy in 2006 as a field long-term care ombudsman. In that role, she responded to requests for assistance from residents living in Elk Grove and South Sacramento's licensed long-term care facilities. And then in 2012, Lisa became the executive director of the California Long-Term Care Ombudsman Association. This is the statewide professional association that provides leadership and program assistance for the 35 local long-term care ombudsman programs, their staffs, and volunteers. Lisa is excited to be afforded the opportunity to work on statewide systemic advocacy focused on changing the way we view aging in California. We're also going to be joined by Sergio Landeros, who earned his bachelor's in gerontology from Sacramento State and is currently working on a master's in public administration at McGeorge School of Law. Sergio began working with the Ombudsman in 2016 as an intern at the Office of the State Long-Term Care Ombudsman while volunteering as a local ombudsman. After graduation, he worked as a regional ombudsman for the local program, overseeing over 300 facilities, then promoted to program manager in 2019. It now leads his team to provide advocacy activities for over 1,400 long-term care facilities in 7 counties, including Sacramento. And lastly, we have Christina Demas-Khan, who is the current board president for the California Health Advocates Association, or CHA, which provides training and advocacy assistance for Medicare counselors throughout California, emphasizing local health insurance counseling and advocacy programs, or HICAP. Christina has devoted her professional life to service and worked as the HICAP program manager for 13 years in San Mateo County. Before joining HICAP, she served in the healthcare industry for 19 years. And this year marks her 3rd term as a commissioner for the Commission on Aging, which advises the County Board of Supervisors on issues facing older adults and promotes independence, self-sufficiency, social and community involvement. And so next, I will be handing it off to Wanda to share about supplemental security income.
Good afternoon, everyone. Oh, I hear a little echo.
We hear you okay on this end.
Oh, good. Okay, good. I'm Wanda Gonzalez, and I'm your Public Affairs Specialist for Social Security Administration. And I want to thank Catherine for inviting me and Sacramento Steps Forward, the team, entirely for putting this together, this great event, which gives us an opportunity to share information with you about Social Security matters. I'm going to start sharing my screen, but while I'm doing that, I want you to think about how Social Security has connected with you in your life. As we know that Social Security touches the life of almost every American in some way, form, or other. You can see that screen there. Is that looking okay for you guys? This is what I want to do here. Hold on one second. And I'm going to, my cursor is wanting to dance, but I think I got it under control. There we go. You guys see that now?
We see it.
Okay, excellent.
Thank you, Wanda.
And you're welcome. So I'm going to close this off really quick here while we focus on the PowerPoint. And as we talk about how Social Security for over 80 years has been securing today and tomorrow. And most of us, of course, are paying into the Social Security system. But we're more than just a retirement program. And in today's agenda, we're going to talk about the SSI claims taking effort. We're going to talk about the COVID-19 updates, fraud awareness, the My Social Security account. We'll talk about Supplemental Security Income, which is known as SSI in acronyms, the coding of the VPAP and remarks for the SSI claims taking effort, which I'll elaborate in just a bit, applying for benefits, and what we're doing right now in terms of having an ombudsman in our areas and on our regional level, connecting our community partners to our Social Security offices when there is capacity to help us with taking SSI claims. And then we'll, of course, have a Q&A session. So the SSI claims effort, as you see here on this slide, we're remaining to commit to ensuring that everyone has the opportunity to apply for benefits, especially as COVID-19 continues to affect us all. But we need your help. And so that's where this SSI claims taking effort outreach is currently in effect. People that are experiencing barriers are having a difficult time applying for the Supplemental Security Income. As you know, the SSI program is a federal program based on need that provides a monthly cash benefit to people who are age 65 and older, and people who are blind or disabled regardless of age, who have limited income and resources. SSI is also an important gateway to other assistance programs like the Medicaid, or what we call Medi-Cal in California, and the Supplemental Nutrition Assistance Program, otherwise known as SNAP or CalFresh. We know that during this time that the pandemic has affected our operations and the way that we normally do business, people who are aged, children with disabilities, people with limited English proficiency, people diagnosed with mental illness, those experiencing homelessness, our veterans, and people recently released from incarceration are some of the population who are having a barrier to access our services. And that's because a lot of these individuals may not be computer literate or have access to the internet or even a device to be able to get online and do business with us, or even have a telephone, right? And being able to contact us by phone. Because currently, let's talk about how we're operating. We're operating by answering your calls from 7 in the morning to 7 p.m. That's our national call centers. They're able to answer general questions for our public, but once our doors, but you used to be doors, but we're typically doing everything by phone at this time from 9 in the morning to 4:30, your local field office. Our technicians are ready to help you by answering the calls, assessing the needs of our customers, and being able to schedule an in-person appointment if there is a critical need. So during the time of the pandemic, we are able to help our customers by telephone. Most of our business is able to be handled in that manner, but we do recognize that there are times that we have to see somebody in person, and we'll schedule an appointment accordingly. What you're seeing here right now is a slide of our Social Security website. And I want you to visit our page if you haven't done so already, so that you can learn about all the different resources that we have available on our webpage. We actually have one of the best websites in the federal government. We provide information that is user-friendly, easy to read, easy to follow and navigate. You can tell here by the icons. When you select retirement, it will take you directly to a landing page that teaches you what you need to know, when to do something, how to do it. So we really provide our customers step-by-step instructions on how to navigate through our Social Security programs. And we also have a frequently asked questions section that provides over 200 questions already asked. So before you pick up the phone and give us a call, looking at the frequently asked questions might save you time, and you might be able to find the answer there to something as general as, how do I apply for a Social Security card, which is one of the most popular things. How do I get a benefit verification letter, right? A lot of our people need to know how to get proof of income. And so we have banners, as you can see, the COVID-19 banner. We have an emergency assistance and homeowners and renters banner, because we know that the government has been able to share additional resources during the pandemic. And so we at Social Security want to make sure that our customers are aware of everything that they might be entitled or eligible for, such as the income earned credits and the child tax credits, the economic income stimulus payments that were being sent out. This particular snap or snippet of my website doesn't actually show that particular bar, but we actually have one on our website right now. And what should you do if you get a call from someone that's stating they're from Social Security? As we know that scam and fraud awareness is really important to spread that information. Now, the coronavirus disease COVID-19 updates page is regularly updated, and it provides accurate and timely information for you all. We recognize that things are changing, pretty rapidly, and we need to keep you informed. So even when you call our telephone lines, we have about 6 messages that will share the latest updates with our customers who are on hold, listening to that information so that they can be prompted to know exactly what they're looking for. And as you can see, we have information and topics and categories as we're starting to gather more and more information regarding hearings and appeals, and the most popular item, which is how to apply for a Social Security card. Talking about information about identity theft and fraud and waste, that's really important to us. We do everything that we can to protect your personal information. We want to make sure that people who are in isolation right now because of the pandemic, trying to stay safe, that they're aware that Social Security is not going to just make a call into the community and never threaten or ask you for information such as your debit card or your banking information. We just don't do that. And so please, if anybody hears or receives a call of that sort, just hang up. It's the best thing to do. If you want to report your fraud, waste, or abuse, you can always visit the Office of Inspector General for Social Security and report that information to us. We're constantly doing everything that we can to fight fraud and bring awareness to our customers and ensure that they understand that we're here to keep them safe and protect their information. Hopefully everybody got a chance to open their My Social Security account, right? Because the My Social Security account is your personal access to the portal of your information. Does anybody remember when we used to send the statements in the mail? The statements that used to tell you your projected estimated retirement amounts for retirement age. Well, we stopped doing that. We went green, and we were able to save a lot of on that, on the cost that it takes to mail products out to you and print products. Now we give you the access at your fingertips when you desire, when you want to log into the My Social Security account. So please create your account. All that is needed is for someone to be age 18. They have to have an email address and they have to have a U.S. mailing address. So those three things in order to be able to create a My Social Security account. When you have a My Social Security account, you can do so many things from the comfort of your device. So you can log in from your phone or from your tablet or from your personal computer, and you can request a benefit verification. If you receive benefits, you can get maybe change your information such as direct deposit or address or telephone number. Even if you do not receive benefits, you can ask for proof of income so that the letter that propagates and is available for you to print, or you can request it to be mailed to you. It will provide information such as Wanda does not get benefits from Social Security, or Wanda does, and this is how much she receives. And so it's really great. I think it's the most effective way to get information at your convenience. And it's really safe to use. We do definitely require you to have a username and a password. And we even ask that you have a security code sent to you before you access your account in order to safeguard your information. So create your My Social Security account. We've just recently released supplemental fact sheets that took place in October. It's really neat. It makes reading and understanding your personalized accounts information a lot easier so that you can better plan and project for your future. I think we all have to think about retirement, right? Even it's never too early. Now let's talk about Supplemental Security Income, SSI. What is it? Well, most of you are probably very aware of the SSI program. And as I mentioned earlier, it's a federal program that provides monthly payments to people who have limited income and resources. And it's for our people who are age 65 and older, as well as those that are at any age, including children who are blind or who have disabilities and have limited income. The requirements for getting the SSI, you must have the limited income and few resources. If you are an individual that's under $2,000 of resources, if you're a married couple or holding out as a couple in the community, then the resource limit for a couple is $3,000. So as you can see, it's very limited resources and income. You have to be age 65 and older if you're going to apply for the aged benefits. But if you're under age 65, at any age under age 65, then you have to have a medical condition that keeps you from being able to work. And that condition is expected to last at least 1 year or result in death. There's different rules for the children. The children, of course, when we take a look at their information, it's about their ability to learn and their daily activities. How are those limited versus an adult, which we would then look at their work abilities and ability to sustain themselves. So there are two different ways that we view an application for a child versus an adult. We launched the SSI icon on our website over the last year. And we're so proud of that because we recognize that SSI, it's not easy to really understand. It's so complex because there's so many different variables with SSI eligibility. It's very different from the SSDI, the Social Security Disability Insurance. With SSI, there's a lot of different rules, and as you can see here, when you visit our SSI landing page, you're going to have this little, these three links pop up: children under 18, people ages 18 to 64, and then people age 65 and older. So you'll be able to click on these three different links to expand and read more information about the SSI program and how it applies to those groups. When you click for children, you'll see this page, and it will basically allow you to start the disability report. Because with the child, of course, we're going to want to know what is the disability. And there's disabilities, you can't see them sometimes, or you can't tell. So my advice is, if you feel there's an impairment, have the parent file, because we just don't know until our Disability Determination Services Office obtains the medical records and school records and any other records that are necessary in order to make a determination. That's when that decision is being made at that level. So we'll talk about a little bit about how our disability determinations are made. So as I'm saying, when's a good time to apply for the benefits? As soon as you become disabled. We know that a lot of people struggle with the idea of not working anymore and giving up that independence, or feeling like they just don't want to come and ask for assistance. When you apply for benefits with Social Security, we're going to take a look at your earnings record, your work history. What have you paid into Social Security? Are you currently insured? So we'll determine that piece, as well as then taking a look at the SSI application. We will definitely do concurrent applications, meaning with every customer except for children, because we know they're not working. We will take a look at, are they eligible for Supplemental Security Income? Are they eligible for Social Security Disability Insurance? So we make those determinations. And please, if you're a social worker and you're assisting a client and you're seeing a denial letter, take a look at the header of that letter, because the header of the letter will guide you into understanding what department is making this decision. If the letter is regarding Supplemental Security Income, it will say that on the top. If it's regarding Social Security Disability, retirement, or others, it will say that on the top of our letter. So the letter will guide you and be able to allow you to understand what department is denying what eligibility. Because if somebody is eligible for Social Security Disability, but not for SSI, because maybe they have over $3,000 in their bank account, well, clearly they're going to have a technical denial in one program, but the other program will still be investigating, and then vice versa, right? Maybe somebody didn't work enough, so therefore there's not enough credits in order to pursue an insured status type of application, but maybe they do have low income and low resources. So we continue the disability investigation to make a medical decision and then determine whether they're going to be eligible for benefits there. So there's a lot more to it, right? And it can be really, really confusing. So we welcome you to get yourself informed and learn more about the different programs that we administer, because there are so many. And at Social Security, we are here to do a matrix each time to look at what our customers are eligible for. We ask the right questions to know, are you a survivor? Did you have a spouse that passed away? Were you divorced? Were you married for a certain amount of time? Do you have any dependents in the home? How old are they? Are they going to school full time? We do all of that to make sure that every customer is getting the appropriate entitlement checks that they're due. Now, with Social Security Disability Insurance, as I mentioned earlier, it's a monthly benefit, but it's to people who are no longer able to work because of significant disabling conditions. Social Security does not pay partial or temporary disability benefits. So when we're making determinations, we're making disability decisions on impairments that are really long-term. Something short-term might be like a broken leg and you're going to be fine in maybe 2 months after wearing a cast. But if you become an amputee, it obviously is a life-changing event. So it's for people who cannot perform substantial work activity. They may qualify if that condition is expected to last 12 months or more. When people apply for benefits with us, we always encourage them to take advantage of applying for anything else that they're entitled to. So we always refer folks to apply for the EDD's benefits, the disability program, the unemployment program, anything that they may be entitled to collect. We strongly encourage folks to apply for those benefits as well. And what you see here is a comparison side-by-side slide here, just so that you can kind of get a glimpse of what the SSI program versus the Social Security Disability Insurance and how it differs. So as you can see that the SSDI, it pays benefits for workers and adults disabled since children, and that meet the insured status requirement. And how do we know if someone meets the insured status requirement? Well, remember the My Social Security account I mentioned? When you create your My Social Security account, you're able to see your earnings record. You're able to see all of the earnings that were reported to Social Security by your employers and the IRS. It is our responsibility, not me and SSA, but yours, everyone's responsibility to verify that that information is being accurately reported to Social Security. And that's because you're the worker and it's your employer reporting that information to us. And sometimes there's mistakes, right? Sometimes there's typos. And so if anything like that happens, it's your responsibility to get an updated W-2 and send it to us so that we can make that correction. So if you wait until you're 62 years of age when you're looking at considering retirement, and that business that you worked for 10 years is no longer there and they inaccurately reported earnings to us, then you're shy that year, right? That year is missing the correct amount of earnings that you worked, and therefore can change your projection with us. So I hope that will motivate you to take a look at your earnings record and just to ensure that it is accurate. And it's a good thing, a good practice to do so every year. Now, for those social workers who are helping the client, and if you're helping them create their My Social Security account, which is okay to do, we just don't want you to try to do it on your own without their permission. They have to be there with you. You know, they have to be there with you because we don't want anyone creating accounts without someone's permission. So when you're looking at that person's information, if you're able to assist someone successfully create their account, and you're going to be able to see the projected amounts for even disability. So you can kind of get an idea, oh, Mr. Brown, he's eligible. You know, he worked all of these years, and if he's disabled, so if he files for benefits, this is the approximate amount he's going to get. It's really great. It really empowers you to know what that looks like for each client if you're helping a client with their application for SSI. SSI does require you to report pretty much anything that happens that may affect eligibility, such as living arrangements, such as your income and your resources. And when we talk about income, we're talking about self-employment, we're talking about pensions and annuities and anything that's coming from anywhere else. Winnings from the casino, things of that nature. So we want to know how and this may change the ability to provide you the right dollar. You know, because we want to pay our beneficiaries, our recipients, the right amount, and not overpay them or underpay them. So when it comes to SSI, we ask our SSI recipients to report changes within 10 business days. And it's their responsibility. We give everyone a responsibility report. We do reviews with our, let me go back here. We do reviews with our customers every 2 to 3 years. That is something that we're required to do just to make sure that we are accurately managing benefits, you know, for folks. So if you're hearing from a customer, oh, Social Security wants to talk to me again, they sent me a letter, because we will send a letter. Like I said, we don't just make random phone calls into the community. We will send a due process notice. So the customer will get a notice, and then we'll attempt to reach them by phone if we do not hear from them or they don't appear for their reviews. We know that with people experiencing homelessness, this may be difficult because they're not going to get their letter. Their letters are going to get bounced back. And when that happens and we're unable to reach our customers, we may interrupt the benefit for that month just to get our customer to reach us, because a lot of customers might not, you know, remember to do that, or they're not reporting their changes of address within a timely manner. And so it is difficult for us to communicate. And so if anybody reports, oh my gosh, I didn't get my check this month, I don't know what's going on, it may be that we just made that interruption because of many failed attempts to reach a customer. Now, how do you apply for benefits? We would like everyone to apply online because it's the easiest way. It saves you time from driving into an office, from waiting in our lobby. Filing online, you can take breaks. Yes, you can actually take a break and re-enter your application with your re-entry number at a later time. So, a lot of us are getting used to doing things online. It doesn't seem so difficult anymore. We're doing everything by camera and our phone. Even when you go to the DMV, right, you go into a special room to sit there and complete your application on the computer before you go see a technician. So we're seeing that we're becoming more used to filing online, but not a lot of our customers, right, especially those facing barriers, we recognize that they need our help. And so we appreciate having this opportunity to talk about how are we working with our community partners to help reach those folks and what we can do together to teamwork and to be able to be there for one another. And as an ombudsman for the Sacramento area, I'm your person that if you have an agency, a partner, a business, like a nonprofit, if someone has the ability to help Social Security with reaching our customers, our mutual customers, and helping take claims, I'm going to train you. I'm that person that you're going to contact, and I will provide training to your staff so that you can better understand SSI, the forms that are required to be filled and completed, and just to understand, just for your Q&A, just to kind of understand what does that look like. One of the greatest things that came out of this effort is being able to connect the organizations in our community to a liaison in the SSA office when you're taking SSI claims. And I've been working for this agency for 20 years. Everyone would love someone, a go-to, right? A liaison to say, hey, Wanda, I have this question. I need help with this. This particular liaison is going to be there to help with SSI claims. Our liaisons are also doing their own personal workload. So we know they're going to be very busy, managing both positions there as a liaison and just as they're expected to do in their offices. But it is a good opportunity when you do have a customer that is not able to get through, that if you have the proper forum to represent them, that you can ask that liaison a question that's maybe not related to SSI claims. So there is that little bit of an advantage, but it is not the actual purpose for that. We definitely want anyone that has a general question to call the office local phone number or contact our 800 number. But better yet, look on the internet, because that's what we're all here for, right? We're the resource advocates for the community. So I know that you're very resourceful in researching things. And so you're welcome to visit our website and find the information that is needed. We will give you a fax number to directly send paper applications during this time, during this pandemic, so that the applications that you are helping us with taking for your client, maybe it's a requirement for your agency, maybe it's part of the process, and so it's something that you currently already do. This work track number will ensure that your application is safely delivered to us, and that the management member at the local field office is going to be able to get that application and hand it to the liaison or assign it to the liaison, all within our electronic application, which is really cool. No losing the document, right? No misplacing the document. The document is faxed in, it's date stamped, it's secured. But of course, filing online is the best method. Referrals, we still want your referrals. So please, if a customer is unwilling to provide you the information, then please contact our national phone number so that you can contact a technician and send the referral through. Our Google, I know that Google is America's most popular engine search, right? That's what we use to find everything within our area. And so if you look up a Social Security office in Google, you are going to find the local field office number. We work with our Google business listing to ensure that every Social Security office is accurately has the phone number and the address for each office in your area. So you can use Google, but if you're not able to use Google and you want to go to our website, we have the office locator tool, and you're able to plug in the customer's zip code and you'll be able to find your local office phone number there. We have lots of information from our menu bar on our homepage. You'll find that right at the top of the header of our homepage. And when you expand on the menu option, you're going to see information for all sorts of different groups, all sorts of different information needed for maybe just applications, or information needed for, for representative payees or advocates. So you'll be able to find things. And I just plugged these in here because I thought this would be most useful for you. And these are active links that I will be sharing with Kathleen, and we'll be forwarding those on to you so that you have them at your fingertips, because we know you're helping others. We know you're from a group or an organization. So how does that play a part in our relationship? You're providing services for folks that are experiencing homelessness. How do we play a part in that? Compassionate allowances. What does that mean? Social Security continues to improve our services, making things a lot more, allowing that when something is being completed, such as a disability report, and the customer or an advocate is putting in the impairment that the customer is alleging, that if it hits one of these specific disability words, that our system picks it up for a compassionate allowance. Certain cancers, certain ailments that are really, just depending on how you basically list that impairment, that our system is picking this information up. So becoming acquainted with these compassionate codes is really useful for you as an advocate if you are helping people fill out an application, because it will allow your client's application to basically get picked up for maybe a quicker determination at our Disability Determination Services office. When people are applying for disability benefits, your application is going to be sent. The application for the customer is going to be sent to the Disability Determination Services office. The Social Security does not make the disability decision. We are here to help determine eligibility, but we do not make medical determinations. We work with the Disability Determination Services office, which is actually a state entity. They have medical analysts and examiners who review every client's documents, the medical records, and determine whether a customer needs to see a doctor. Maybe there's not enough medical evidence. We've seen customers like that, right? They have a lot of impairments, but they've never seen a doctor because they don't have insurance. And so our DDS, that's the acronym, will then determine, hey, we need to send this person to have a consultative exam so that we can make a fair determination. And then, of course, we go through the appeals process, because everybody has the right to file an appeal at Social Security. And you can actually file appeals online as well. Don't wait. Don't let your customer wait. If your client needs to file an appeal, you can do so from the internet, from our website. And then, of course, information for people like me. And what does that mean? People like me. I mean, I'm Latina, so it would be like people like me. So you have all sorts of different groups of audiences, and so maybe you'll find information that's really relevant to your customer. The SSA forms and the VPAP coding for this outreach effort, the SSI claims taking, where we're asking our community partners to help us with taking the claim. If you have the capacity, and I'm going to schedule a training with you, we can schedule a meeting to talk about this, and then we can schedule a training to go over what is the expectation, because we're just happy that you're willing to help us. And so we can cover the application necessary to file for SSI. We have a full version, we have a condensed version, and then we have the remarks section that is really, really important to code VPAP so that we can identify the application being submitted to us, whether that's electronically through online or whether that's through the work tracks fax. And so that we can be able to grab that application and know that it's coming from from our partnership that we've established. And then of course the SSA 827 is so necessary because without it, we really can't move forward. And that's just permission to release information to us, particularly medical information. So follow us on social media because we have our @Social Security accounts. We're modern, right? We have to catch up with everyone. And so we recognize the value in having these social media platforms. We provide so much great content on these platforms. It makes it so interesting. We provide fun facts. I mean, there's so much to learn about Social Security because we're not just a Social Security card, and we're not just a retirement program. You know, we provide benefits for the survivors, for divorced spouses, for dependents, for adult children that are disabled, and more. And so we share a lot of great information, a lot of great videos on YouTube. We have our Facebook Live events. Just make us one of your partners on your social media platforms and stay connected with us. And I will stop there and stop sharing my screen so that I can give it back to Catherine. And Catherine, you can tell me what to do next.
Yes, hi Wanda. Thank you so much for your thorough presentation. We see some questions have already popped in through chat, so we'll jump into Q&A for the next 15 minutes. So if you have any more SSI specific questions, please drop them in the chat, or we'll also welcome you to use the raise hand feature so you can ask verbally. I'll just prioritize from top to bottom here. I'm just looking through chat. I see from Anne.
Are you reading the questions for me?
Yes, I will be.
Okay.
I see one from Anne. She is asking, I work with young adults and they have never had any luck opening up an SSI account due to not being able to verify the individual. Any tips or tricks?
Ooh, good question. Are you talking about the My Social Security account? I'm assuming yes. To create the My Social Security account, right? Someone has to be 18, have a Social Security number, and also have a U.S. mailing address. It is not uncommon for someone that's very young who's never established credit to have some trouble creating this account. And I'll tell you why. Because we do use information that's from the Experian report. And if there is no credit established, then there might be some trouble trying to get that account created. But we thought of that. And so what Social Security is currently doing is finding other means so that our customers who might not have enough credit in their credit history to not have any difficulty with creating this account. So please stay tuned. We'll continue sharing more information as we keep expanding on that. But some of the alternatives now are the ID Me. There is an ID Me availability. So customers that have that option to create the account without having to go through the whole credit background comparison information. And for those who are just hearing this for the first time, it's not a hit to your credit report. So don't be nervous about that. It doesn't have any impact on your score. And so, yeah, good question. Thank you for that.
And then Wanda, another here. I tried to open the account, but I couldn't successfully answer the out-of-wallet questions. Does anyone remember what bank held the car loan from a car in the 90s? How else can I open an account?
Yeah, exactly, right? And so we make it hard so that no fraudster or scammer is going to take advantage of your information and create an account. Even husbands and wives have difficulty trying to help create an account for one another because it's that difficult, right? It's going to derive information from your credit history. And yes, Sometimes our memory doesn't serve us any good anymore, depending, how that main organ is functioning. So it might be tricky to remember facts about what happened in 1995, and so again, because of that, we've continued to expand the ability to create your account, not just by out-of-pocket questions, but by also using the ID Me. There's another one. I want to say it's on the ID Me, and then there's I think it's something gov, but don't quote me. I will find it and I'll put it in our chat for you guys later so you can give it another shot. But if you haven't been into our website lately, try again, and you'll see the different options to creating an account. Good question. Thank you.
And then I see Fatima, who has her hand raised. Please go ahead, Fatima. Are you able to unmute?
No, I'm here. So just to lean in on some of those limitations, I don't know, I haven't been able to find an appropriate way to highlight some concerns with that process, because I've really had a difficult time, especially during COVID. Because some of the populations we work with don't have phones and various things like that. Also, like even to get a card, like you have to mail in a copy of your ID, or not a copy, your physical ID, mail it in, and then they have to mail it back. So it's this type of daisy chain thing, but also to really look at our transitional age youth folks, our kiddos or young adults, and know that their parents, like I have a 21-year-old, he doesn't know all the addresses that I've used to get his social security card. So that's a limitation. And there's no, even for myself, trying to get one for my child and trying to help him get one, there's no one to talk to communicate these concerns. So just really, concerned as a citizen and stakeholder is Social Security thinking of these things while their office is closed, because it's a huge limitation. There's no physical way. Understand, we definitely don't want people to get our information. We want it to be hard to crack in there, but there needs to be some kind of safeguard and understanding, the capacity of the folks that we're working with.
Absolutely, Fatima, and I appreciate your feedback, and it's really important that we're able to provide the services that we're so used to providing in person by online. And of course, we know that sometimes mailing something into our office, we can expect some delays because there are a lot of mail being processed. And when you're having to send in your original document, some of us don't want to send in our original document. That's what's required. You mentioned a photocopy, but we actually need to see an original document when you're requesting a replacement Social Security card. So yes, we've thought about all of that, and we're actually taking a look at how we can better provide services through our camera features, being able to conduct enumeration interviews in this manner that we're doing today. Technology continues to be enhanced, and so it is something that our agency has been examining. When we talk about the My Social Security account, and we know that some of the youth might have such a difficult time in being able to establish the My Social Security account. I was able to open up my website, and I do see that it is signing in with login.gov, signing in with id.me, or signing in through the typical answering out-of-pocket questions. So now we're giving you 3 different options to be able to create your My Social Security account. So you can give everyone a try and see if you're able to successfully get in there. A lot of times it is really easy. I tried it not too long ago for my mom, and it was just taking a picture of her ID and being able to upload it because, again, we continue to enhance our technology. One of the things that we recognized that was so important was that Social Security number card, right? And so during the pandemic, that is being a big need. Is equal as the benefit verification letters that people need to provide proof of income. And so when you call our 800, our numbers, our telephone numbers, that is something that we can, there's a prompt, and you can actually select to have something mailed to you, the benefit verification letter, 1. And then if you talk to a technician, I know it can sometimes be, 15-minute wait, 25-minute wait, and we appreciate you hanging in there with us. Because our technicians are ready to help you. When you speak to a technician, they can also provide the option of just mailing you the proof of your number. It's what we call our NUMI Lite. It's something that we quickly put out as a service to our customers during the pandemic, because we recognize the need for having proof of your social security number when you can actually apply for a replacement card because of issues maybe online, or the preference to not mail in a document to our offices. So that could be an option, Fatima. The NUMI Lite, when you talk to an agent, just say, hey, I need proof of a social security number for my son, if that's who you're calling for. Of course, if your son is an adult, they have to call, they have to be on the call as well, in order to be able to get that document. And that's what we're doing in order to help our customers right now. So we recognize the importance of getting that. Another thing is a lot of employers, they have access to verifying social security numbers. So during this time, we're seeing that a lot of employers have a lot of flexibility with being able to give their new hire some time to prove a social security information. But one of the options for employers is using their access to get to us to verify information electronically. So that is something else that employers have the advantage of doing for their new hires.
I appreciate that. Thank you so much for those innovative things. I just want to raise one last point and I'll yield. The impact of BIPOC individuals not having an identification card is dangerous. And it was a very scary thing to tell my child, we're like, because you need an ID, you need a social security card to go get an ID. Like
Not
if you've
anymore.
never, no, but
So,
I'm saying, what I'm saying, if you've never had one, you need a social, you need some kind of proof to prove who you are. So it's just like, also some of these systems, like kind of what you guys, I'm glad you're sharing this, these systems working together. So Social Security working with, you know, DMV, working with your employer to get some of these things, because the fear and also understanding the fear of our, you know, stakeholders and of our community of what it's like to walk around and not have an ID. It doesn't feel safe to, I have to physically mail my ID card into Social Security and I won't have one until I don't know when, why, you know.
right.
So really keeping that in mind for our folks, that it's really hard for them to keep documents, especially our folks that are unsheltered. So really keeping these in mind. And I'm so proud. Thank you so much, you guys, for all you're doing, Miss Wanda. So happy.
Thank
you.
you. No, thank you. And for those who haven't heard, the DMV in, I want to say April or May, they removed the requirement to show a social security card when you're applying for one of their documents, their IDs or their, it's not a requirement. You just need to know the number. So most of us have it memorized, and we all know that the social security card was never intended to be carried in your wallet or in your purse. So if you're doing that, you got to remove that document, because that's, you know, very important. You could lose that, and next thing you know, you have a lot of headaches, right, with identity theft. So remove that document, because that document, the only intention is to work. It's the proof that you can work in the United States, but a lot of agencies are utilizing it as a form of identification. It was never intended to be that. So the DMV no longer requires that a customer show a social security card. So that's the good news. If you haven't checked that out, visit the DMV's website. You'll be able to see that information. So we've seen a reduction in the request for the social security card for the real ID purposes, because the DMV has changed their policies and procedures, which is really great. So yes, we are thinking of innovative ways to be able to help our mutual customers and make sure that we're not creating barriers, but rather helping our customers. Thank you, Fatima.
I just wanted to say thank you to everyone who's uplifting these great questions and comments, both verbally and in chat. We're doing our best to track these questions. The next one up is, do you have interpreters for phone calls?
Yeah, we do. So every telephone handset has a phone number listed internally for our employees to be able to utilize translation services. So yes, we have translation services available at our dispense.
And then from Christina, how is substantial work activity determined? Is it by the job duties, amount of hours, or amount of money made?
That's a great question. It is by the amount of money that's made. And each year we make changes to our thresholds based on the cost of living expenses and things of that nature, inflation. And so you'll see the substantial gainful activity level amount change from time to time. So it's really important to stay in the know. We release that information every year. You can find it on our website as well. I'm not sure if Rosa is on the call. Rosa, are you on the call with us? Rosa is our area work incentive coordinator. She works with me, and she's an expert at this question. But I'll be happy to send timetables information so that you can be able to see what that looks like, and that way you can continue gathering that information so that you can determine whether your client, if you're assisting them with anything that they're staying within, or information that's needed in order for eligibility purposes.
And then this one, I work with homeless veterans. There have been some cases when a veteran is approved for VA disability that their SSDI gets dropped. In most cases, the veteran's VA disability award is way lower than the SSDI, making it even harder for them to afford housing. How should the vets navigate this when it happens? And are vets limited to one or the other? I'd like to better understand.
That's a great question. So with our veterans, maybe you're talking about SSI, because if someone receives VA benefits, they can still receive SSDI benefits, because the SSDI, the disability insurance, is the worker who's become disabled, has made those contributions, paid taxes into the Social Security system. So as long as you have a disability, that's not going to affect your eligibility for VA. But with SSI, any income from anywhere else is going to affect eligibility. So it's important to know that SSI is there to supplement any other income that you're getting, as long as it's within the thresholds. And SSI is the amounts are quite low for what a person receives in terms of what that amount is every year. It does change. We're seeing the highest increase based on cost of living this next year in 2022 that we've seen in a long time. So that's really good that we're able to see this for our SSI community. I think it's about a $50, $49 increase, something like that. But SSDI, the eligibility amount that you're going to get from SSDI is based on your contributions, your work history, the amounts of year that you worked. And so every individual is going to be different when it comes to the SSDI. So if someone gets SSDI and they get a VA check, they can get those concurrently without any issues. So if somebody gets SSI, the minute the VA check comes in, we're going to look at how much that amount is and then adjust the SSI.
This next one is from Laura. Assuming the My Social Security account is not successful, can caseworkers request to have award letters faxed over, provided that the client is present and has verified their identity over the phone?
Yes, we have the form 3288 and a 1696. Write that down. And if you go to our forms section on our homepage is the one-stop shop. It's going to be able to show you the publication section, forms, and when you gather that form and print it and get authorization from your client, that is how you are able to successfully request things on behalf of your customer. If your customer is not able to be on three-way, things like that.
And then let's see here. From Maryland, there is a client at our agency that has been denied for disability 5 times and claims she has a lawyer. How can we help her?
Oh, that's a great question. When someone has been denied because of their disability, we encourage them to continue filing through the appeals process, right? Is that person being denied for technical reasons? Is it because of income and resources? Because that is something that we're going to determine at the field office. And if someone's income and resources changes, the very next month, they can file again. And the very next month, they can file again if they're being denied because maybe they have a property in their name. Maybe they have 5 cars and they're just unable to get rid of those cars. But we're counting some of that as a value, right, of the amounts, because we take a look at everything that the client has in order to determine eligibility. When someone has a medical disability and they're being denied because they're not found disabled enough, right, we're looking at that 12-month, long-term, but when the medical analysts and the examiners are taking a look at someone's profile, they're determining how much education this person has, how much work history this person has, what is their age, and a lot of different factors to make a decision. So having a lawyer, having an appointed representative help them is really useful. It's what I always encourage people to do, because it is difficult to really understand unless you're reading the letters that are coming from Social Security and really taking a look at why that person was denied. So there's a lot of myths. Get to know the truth and the facts by visiting our website. People say, oh, you're going to get automatically denied on the first time that you apply. That's false. That's not true. If someone has stage 4 cancer and the medical document comes back and that's what it says from the doctor, well, that's, we have that information. But if someone says, oh, I got into a car accident and I have back pain, but you don't have enough medical history to even show that there is, in fact, an impairment that keeps you from being able to work at the substantial gainful activity level, well, you might have a denial and you'll have to fight it and show proof that you actually have that impairment in order to be approved for benefits. So every case is unique. We just encourage people to continue talking to us, to getting that education and knowing how to continue with the application process.
This next one is from Jolene. What if a client gets Social Security and wants to work part-time? How will that affect his check?
We want our customers to rehabilitate and get back into the workforce. We do, right? Because it makes you feel good, right? When you're working, when you're getting out of the house, when you're getting yourself dressed up for the day. So we recognize all of the benefits for working. And Social Security, because we have so many work incentives, we help our customers. It doesn't work against them, but rather works for them. And so we have information on how does work affect your benefits. And it's important to learn that there are incentives such as, do you need special shoes because you have something wrong with your feet in order to be able to work, and how can we exclude those expenses? We have all sorts of different scenarios and incentives. So that myth that or the mentality that I can't work or I'm supposed to only earn so much because I wanted to affect my SSI, that's just it's just not a good method to operate by. When you're working, you're also getting taxed. So you're paying into Social Security, the insurance program. So it's a win-win if you think about it, because if you're working, yes, we might modify your SSI, but you also have income. And we don't count your check dollar per dollar. We actually apply some exclusions before we actually reduce your SSI. So get to know about how work affects your eligibility, because there's a lot of advantageous ways to be able to work with us and help you maintain and improve your quality of life in that sense. That's a great question. Thank you.
And then from Andrea, what other agencies help clients apply for benefits, aka SMART programs, still around?
Oh my God,
Andrea, if you're still on.
I was the first SSI technician to work for SMART. For those that don't know, SMART was something that my actual former boss, somebody who I looked up to so much, he retired about 3 or 4 years ago, helped create along with other entities in the community. And you might remember, we would go to El Hogar and over by Salvation Army on A Street. I know they moved over to Burkett or something like that, but Social Security and then the DDS and the medical examiner, we would all be there to help our clients that have homelessness and mental illness, and we would be able to do a one-stop shop for our folks. We still do that, and it's such a successful program. It's something that I'm a big passion, I have a lot of passion for. We have a lot of partnerships in place right now, some that are similar to the SMART program practices and some that are not. I can share what I know, and then I'll pull some things up for Catherine to share with you all. But we do know that there's a lot of partnerships. I know the legal clinic over in Oak Park, working along with, who are they working along with? It's the Sacramento County Department of Health and Human Services. So they have a team in which they're taking applications for clients. And there's a lot of great partnerships that have been established. When this SSI claims taking efforts started out, I was like, we already do that, you know, we're already doing that in Sacramento. So it was really neat. But we're continuing to do these partnerships. So if you are interested in doing that with us, please, you know, reach out to me.
And then we have from Samantha, clients usually have a hard time keeping email addresses and passwords. Would an org be allowed to utilize a company email with a client's permission?
That would be something that I can't speak to. That's up to the client and yeah, so it's up to the client.
Thanks, Wanda. And then I see we have a couple more minutes remaining in this portion. This will be our last question for Wanda for today. When an individual has a mental health disability and receives benefits, who determines from SSA when the person is no longer disabled? Would they be a medical professional?
Yes. So I mentioned the SSI reviews, right, that we call redeterminations that are conducted every 2 to 3 years to ensure that someone meets the income and resource eligibility. But there's also the continuing medical review. The continuing medical review is for someone who has a disability, right? So folks that are under the age of 64 and younger, that have an impairment. Based on their impairment that our medical examiners have determined to be, you know, maybe more severe than others, we will then conduct a medical review every 3 or 5 or 7 years. And what we do is we contact our customer, we ask them to update us with their medical records to know, you know, just to share, you know, who have they seen in the last 12 months. And so we then gather that information and send it back to the DDS where they made that initial decision. And the DDS will then request medical records and examine all of the information and make an analysis on whether this person has the impairment that continues. You know, some things are black and white, right? We have Down syndrome. Is that improving? And we have scenarios where you have a back problem, but now you had back surgery and now you're in a good condition. So you therefore sort of rehabilitated. Are you eligible for benefits? Or you have a customer who got approved because maybe they had a condition and then they just stopped going to the doctor. And so now, how are we to prove that this condition continues without any evidence? So we have those scenarios where we work with our customers. We have benefit continuation requests from a lot of our customers who might fall into an issue where their benefits get interrupted because we made a decision that they're no longer disabled, they no longer meet the rules, and they're saying, no, I do, you know, and in fact, I can't have you stop my benefits because I can't pay my rent next month, and how am I going to do that? We have benefit continuation, but we need our customers to act quickly when we're sending these determination letters to them. When we're saying, hey, this is time for a review, or hey, we did not find you disabled, now you're going to have your benefits stopped in 2 months down the road, because we give people enough time to prepare for these changing situations and allow them to submit anything that they need to submit to continue benefits, to appeal that decision. That's a great question.
Thank you so much, Wanda. That was a very, very helpful presentation and very, very helpful in this basically rapid fire session here in Q&A. So really appreciate it. And I know folks in chat have been grateful as well. And so now I would like to transition us into our break. We'll take about 15 minutes to take a break here. Feel free to grab a water, get a bathroom break, get a snack or so. We'll return at 2:25 with Lisa and Sergio to share about our Ombudsman programs. And then they will pass it off to Christina later on to share about our Medi-Cal and Medicare programs. So please feel free to turn off your video if you are joining us online. And if you have any more questions that are SSI specific or related to the Ombudsman and healthcare programs, please feel free to drop them in chat and we'll address them in our Q&A portion later on today. voting here. And then Lisa and Sergio, you should both have co-host permissions. Please feel free to start whenever you're ready.
I'm hoping that you can see that screen.
We can.
Wonderful. And I'm hoping, Catherine, you'll help us out because I don't have the ability to see the chat with the way this is set up. So
Absolutely.
Okay. So first, I want to thank you for this opportunity to present before you. It kind of happened as an accident, but I learned a lot from the previous speaker. And so if that's any indication of the relationship that's about to start, I'm super jazzed. So a little bit, I'm Lisa Coleman. I'm the Executive Director for the California Long-Term Care Ombudsman Association. Ombudsman, the word simply means to be an advocate. It's a Swedish word. It has a long history of representing those that don't have a voice. And so the long-term care ombudsman program has been around since Richard Nixon, that every older adult or adult with disabilities, individuals who live in licensed long-term care settings have the right to a free advocate. And so CALCOA is a nonprofit association where our mission is to provide the advocacy assistance to support the 35 local long-term care ombudsman programs across the state. Sergio is one of CALCOA's members, and you're going to get to meet him. And as a representative of a local program, it seemed like it made more sense for him to talk about the specifics of how this impacts Sacramento. So a little bit about the Ombudsman program, because what I know to be true is no one knows what the Ombudsman program does or who they are or even how to reach them until after you discover that you are faced with a challenge in skilled nursing or assisted living facilities. And that challenge could be something very simple, that you can't get services that you need. Or it could be very complex, that you are being evicted. You can't find a place to get the services in a long-term care setting that you need. In California, the way the Ombudsman program is set up is we are a part of the 33 local area agencies on aging. And Sergio is going to talk a little bit more about that, because I think that from what little I know about your organizations, there are probably services that your clients could utilize that come from the local area agency on aging. So again, the Ombudsman program. So we have Ombudsman programs that are direct service providers. And what I mean by that is, it's a complicated way of saying the federal government sends money to California. California sends money to the Department of Aging to run the Ombudsman programs. The Department of Aging then contracts with the 33 area agencies on aging. And either those organizations can provide their Ombudsman services in-house, like Sergio's, or they can contract the Ombudsman program to a nonprofit in the community. And so when we're looking at the local programs, we have a wide variety. We have some that are housed within the area agency on aging, and those area agencies on aging are housed within the counties. We have some Ombudsman programs that are a nonprofit standalone, where all they do is Ombudsman services. And then we have some Ombudsman programs that are a part of large organizations like a Catholic charity. The size of the Ombudsman programs vary significantly, and that's what this slide is showing you, that some of our programs are very small, serving just a few hundred people, to the LA program that services LA City and LA County combined. It's over 78,000 residents, so it's a wide range. I'm going to hand it over to Sergio.
Good afternoon, everybody. Thank you for having me this afternoon. As Lisa stated, I am on the board of CALCOA, and I am also the program manager for the local long-term care ombudsman program. for Nevada, Placer, Sacramento, Sierra, Sutter, Yolo, and Yuba counties. Currently, we have a total of 1,358 long-term care facilities within our 7 counties. I have 11 team members on my team. 2 of them are intake staff, 1 is a data specialist, and I have 8 regional ombudsmen that do all the field work, and they're assigned to 8 different regions throughout our 7 counties to provide our services. Next slide, please. So our mission statement is to seek resolution of problems and advocate for the rights of residents in long-term care facilities with the goal of ensuring their dignity, quality of life, and quality of care. Ultimately, I like to always tell my team that our ultimate goal is to advocate, educate, and empower residents in long-term care facilities. But overall, our primary focus or primary role is we do a lot of investigations of complaints of abuse. As a matter of fact, California is one of 5 states in the nation that's mandated to conduct elder abuse investigations. And we conduct investigations of complaints in adult residential care facilities, community-based facilities, adult daycares. We also, of course, do skilled nursing facilities and residential care facility for the elderly, which is the umbrella for assisted living, memory care, and the small boarding care homes. But in addition to conducting investigations of complaints and overall advocating for residents, we also do unannounced monitoring visits, just some people call them general facility visits, or, but we try not to use the term friendly visit. It's just more of a general term of saying general facility visits to check on residents, to make them aware that we exist. For one, as Lisa stated, not many people know about the Ombudsman program. Licensed facilities are mandated to have our Ombudsman poster in the facilities. However, sometimes they might not see an Ombudsman in person for months, days, or even years. And right now, my team is required to make a presence on a quarterly basis. And my team has been doing a fantastic job of hitting all their facilities every quarter and making our presence. So now we're starting to see the positive outcome of this, and more residents are being more aware that we exist and of our services, and to ultimately let them know that they're not alone. In most cases, a lot of residents feel isolated, especially during the pandemic, especially those who don't have family members. So we like to let our residents know that, they do have an advocate on their side to ensure that, that they're being taken care of, as far as giving them a voice, in other words, for those who can't really speak for themselves. We also do a variety of other things as far as information and referrals. Not so much referrals too much, because that's a little bit of gray on our end, but definitely a lot of more providing information to residents and facility staff and family members. So although I'll talk a little bit more down the road about our role as advocates, but I just want to make it clear that we're not state regulators, so we can't really enforce the regulations to facility staff, but we can definitely inform facility staff of what the statutes and regulations are in place when it comes to advocating for our residents and making sure that they're safe and they're being taken care of. We do community education as well, such as today, and we do assist with placement information as far as directing them to a placement agency that's within our same category as governmental, but we do not refer them to private placement agencies or anything like that. My AAA agency on Aging Area 4 does assist with that. They have a person-centered counseling program that assists with that. Of course, I've already stated that we do abuse investigations because it's mandated in the state of California. And a lot of people don't know this, but we also do witness advanced health directives in skilled nursing homes only. A lot of folks do pay, about $100 or so to get this notarized by a notary or get an attorney involved. But when you have a loved one in a skilled nursing facility, you can ask to have an advanced health directive witnessed by an ombudsman. And what we'll do is we'll go out, we'll briefly meet with the resident, ensure that they're aware of what they're signing off on, make sure they have the capacity to make sure that they are aware of the legal document they're signing and who they're appointing as their legal power of attorney or their healthcare attorney. And then we'll go ahead and witness it and sign it off. Next slide.
Okay.
This is usually Lisa.
This one's me. I do want to highlight about that advanced healthcare directive. That might be a tool that your clients would want to utilize because, as Sergio said, you don't have to spend the money to have it notarized. You don't have to spend the money to have a lawyer create it. And yet it allows the individual the opportunity to appoint a person that would speak on their behalf if at some point in the future they can't speak for themselves. It does not, it's very clear, it's only about healthcare. It is not about finances, but it's still a very valuable tool. I have the residents' rights slide because it's just such an important part of for me, of why I want to do the work of the Ombudsman. In general, when you're talking about advocacy and you know, people helping people, there's what's called best interest advocacy. You know, you're doing things in that person's best interest. And that's very typical of the medical profession, maybe law enforcement. I've even seen children that, you know, they want what's in mom's best interest. But the Ombudsman's philosophy is not so much about what is in a person's best interest, but what is their expressed wish? You know, I don't have to live my life in my best interest. I just don't. If I did, I would exercise more and I'd have more in my savings account and I'd probably drink less. And there's a lot of other things that I might do that are in my best interest. But the reality is I haven't committed a crime. I'm not conserved. And so I am allowed the opportunity to live my life as my expressed wish. And the Ombudsman's role is to help lean in close and to help an individual achieve their desired outcome. And that, I don't want to be ridiculous. That's not saying that we're putting, you know, car keys in the hands of someone who has very advanced dementia. But what I am saying is, if the person has if they have an understanding of their actions, then they should be afforded the opportunity to even make a bad mistake. So that falls under the broad category of residents' rights. In California, there's actually a list. It's 19 different rights that these individuals are afforded while living in a licensed care facility. And some of the highlighted ones would be to be treated with respect and dignity, to be free from chemical and physical restraints. You can't get drugged just because you're a pain in the ass. Excuse me, you can't, because you're a problematic person, doesn't mean that they have the right to lock you in a room. You get to manage your own finances to the extent you are able, or assign someone else to do that for you. And when you are in a facility, they can't legally discriminate against you based on your funding source. And that's really important. Because you may be utilizing Medi-Cal to pay for your long-term care does not mean that that care should be in any way less than a person who's paying privately or utilizing their long-term care insurance, or maybe they have a medical provider that includes a period of long-term care. And the residents' right that I thought would be particularly important to this group, it's the reason that I got invited in the first place. I got a phone call from one of your members saying that they were helping an older adult who was in a skilled nursing facility, and that the skilled nursing facility was attempting to discharge this older adult. And they, one of your members is like, this woman is not ready to come back. We can't, in her housing arrangement, there was no capacity to provide her with the care she needed. And that the facility was just saying, okay, well, tomorrow she's got to go. That violates her rights, because one of the residents' rights that I think you need to know about is that people have to be given advance notice about transfer or discharge. You just can't say you got to go. So as Sergio said, he covers Sacramento County, 7 counties. These are complaint trends across the state of what long-term care ombudsmans regularly look at or, advocate, address. Prior to COVID, and which really severely impacted our ability to meet with residents and advocate, the program averaged over 40 to 43,000 complaints a year that were investigated. The fact that we only have a little over 300,000 beds and we had 40,000 complaints, it kind of speaks to the industry. It's pretty problematic if 25% of the people have complaints about it every year. And so the kinds of complaints that we investigate, you can see gross negligent abuse. So abuse could include financial, physical, sexual, financial, emotional. Sergio mentioned that California is unique as one of only 4 other states in the nation that actually gets to investigate elder abuse. In other states, these complaints would go to the Adult Protective Services Department. But in California, because the ombudsmans are already in facilities and establishing relationships with residents as a trusted advocate, we find that residents are more likely to share an abuse complaint with someone that they trust. Over the last few years, you can see the second column is about admission, transfer, and discharge. Those numbers have been growing. In the 90s and the early 2000s, we would get just a handful of complaints about discharge. But when the Affordable Care Act came in and we found more older adults getting into skilled nursing facilities by way of their Medi-Cal benefit, we were finding more facilities attempting to discharge because some of these residents are high utilizers of services, but they don't have a lot. The daily reimbursement through Medi-Cal is significantly lower than the daily reimbursement through Medicare. Right now, on average, Medi-Cal pays $180 to $220 a day for a long-term care stay in skilled nursing. In comparison, Medicare pays anywhere from $600 to $800 a day. So you can see that while the facility is grateful that it's getting the 180 to 200, they would be much happier if they filled all of their beds with the much more lucrative Medicare.
Hey, Lisa, can I give a little background on that? Something I'd like to share with folks so that people have a better understanding how the skilled nursing system, came to be. Originally, SNFs were designed where you go temporarily for your therapy and then you're back out in the community. But as a gerontologist, we are starting to see that the older adult population is growing. And we're starting to see a trend of more older adults landing in skilled nursing facilities due to decline in health, lack of resources, funding, of course, as Lisa stated, Medi-Cal paying for a big chunk of the costs in skilled nursing facilities. But another thing that I also like to mention is that we're also starting to see younger people in skilled nursing facilities. So it's not just older adults. We're seeing younger folks, 50 or younger than 50, land in skilled nursing facilities, and they're the ones that kind of have the worst. They're worse off than older adults because older adults have the opportunity to at least apply for Medi-Cal. But then again, the question is, what do we do for the younger resident who can't qualify for Medi-Cal because maybe they don't have a real quote unquote real disability to be, qualifying for permanent disability and things like that to get those services. And for the most part, they end up in the streets. They end up being, homeless, or because they don't have the family support or the resources to, to go back out into the community. So ultimately, skilled nursing facilities now it's kind of a go-to place for individuals, primarily individuals of low income that can't afford to go back out into the community because of the lack of resources and funding and things like that, and unfortunately declining of health. So skilled nursing facilities, as Lisa stated, Medicare does pay a big chunk of the cost for a short period of time, up to 2 weeks tops. But a lot of people don't know that Medicare can cover up to 100 days. Up to is the key word that you have to pay attention to, because it doesn't guarantee that they're going to cover the full 100 days. So therefore, that's where skilled nursing facilities tend to be a little slick and try to, what I like to call, bully residents out of the facility, or they try to trick them saying, hey, Mrs. Jones, if you don't start paying, well, no, my favorite phrase is, Medicare is going to discharge you on this date because, you no longer need skilled nursing services. Now, the term—
I'm going to interrupt you there because you're getting ahead of us. You're giving away my punchline in slides 11, 12, and 13, dude. Gotta help me out.
Sorry about that.
Right, though, because Sergio,
I get carried away.
Passion for him.
Yeah,
Absolutely.
I get carried away because I worked in the field and I had a lot of success advocating for my residents, preventing these discharges, because people had the misconception of discharge when in reality it's discontinue, meaning Medicare is going to discontinue payment because you quote unquote don't qualify, maybe because the SNF didn't really document properly your progress and things like that, and tend to forget that they have the right to apply to Medi-Cal for custodial care. And I'll go ahead and let Lisa take on before I keep going on this ramble here.
Well, but that's exciting, and that's the part that I really enjoy working with other ombudsmen, because they are very passionate about this. And Sergio's is what his program is experiencing is absolutely spot on with the rest of the state. About 40% of our skilled nursing, which is predominantly our Medi-Cal beds, are filled with residents that are under the age of 60, and that is a change that has occurred just in the last 10 years. It really used to be skilled nursing facilities were for little old ladies that would sit quietly with a blanket sitting over their lap, and that is not the case anymore. And part of why I was excited about meeting with you and your organizations is we have people that are in these skilled nursing facilities that they really don't want to be there. And they aren't really the best suited to be there, but they don't know how to resume life in the community. They don't know about programs like yours that can help them find housing. And so that's where I'm hopeful that we're going to start a relationship where the homeless or the homing programs can work better with the ombudsman programs to help get residents that have a desire to live in a less restrictive environment, or to stay in a facility if that is the more appropriate choice. I have this particular health and safety code up just because I think it's a great one for advocates to have in the back of your pocket. Facilities will often push back and say, well, this person wants something that is unreasonable. And the Older Americans Act says the person has the right to receive services and have their preferences honored, as long as they don't endanger themselves or the health and safety of other residents. So I like to point out that even residents that may be a little prickly, maybe aren't the easiest people to get along with, even some of their unreasonable requests may have a place of legitimacy. And so the ombudsman has to lean in close to find out, well, how can we help you get what you want in a way that does fit within the parameters of the facility. So Sergio, this is one of Sergio's best slides for sure. What are we and what are we not?
So I did briefly mention this in the beginning. So we are advocates, and a lot of people do get kind of confused with our role. But ultimately, I remind people that we're not, the state regulators like community care licensing or Department of Public Health or anything like that. However, we are very knowledgeable of the federal and state statutes, and that is our ultimate go-to resource, and I guess you call it weapon, right, to utilize and inform our residents, families, and staff, facility staff. So in other words, we don't go into facilities trying to look for the smoking gun. That's not our approach. That we don't do regulatory or licensing inspections or investigations of that sort. We do investigations, but we do it with the consent of the resident. What does that mean? That means we're resident centered. That means the only way we take any form of action on behalf of a resident is if we have their permission to do so. if we have the permission to speak on their behalf, if we have the permission to investigate the matter, if we have our permission to do, et cetera, et cetera, et cetera. If we don't have consent, then we cannot proceed with anything. Now, if the resident has dementia or does not have capacity, then our next kin will be the legal power of attorney, and we take direction from them. Now you ask, well, what if the resident has dementia and doesn't have a legal power of attorney? Well, then depending on the severity of the case, then we can shoot that up to the state office and get approval from them to go ahead and proceed with an investigation or proceed to investigate and advocate for the resident's behalf. But ultimately, we are sort of like the middle people in a way. We like to go into facilities and say, here's the problem. Let's work together. Let's come up with a solution so this doesn't escalate any further, where licensing steps in or CDPH steps in. And the same thing with adult protective services. We work with APS, and we do cross support to APS when it's something that's occurring outside the facility. Same thing with law enforcement. But then again, it goes back to the only way we can do that is if we have consent or permission from the resident to do so. We also work closely with community care licensing that oversees and regulates assisted living facilities, memory care facilities, boarding care homes, ARFs, and that sort. And then in skilled nursing facilities, because it's a medical facility, then the regulators for them is Department of Public Health, which is another agency that we also closely work with. And I have the pleasure to have a retired police captain on my team who has established a great relationship with all the local law enforcement agencies in our 7 counties. And we've had great success on cross-reporting some pretty severe abuse cases to local law enforcement, and that resulted in arrest due to our investigation and our involvement. But then again, that goes back to, we had the permission from the resident to go to that extent. But, you know, ultimately we call that the handoff as soon as it's out of our kind of our scope of practice, because all my ombudsman team members have to remain within our scope of practice of strictly just being that advocate. But we do have that authority and that power to hand it off to the next kind of agency to take over if we have permission to do so, and if it's something that really needs to be looked at by either APS, law enforcement, or a state agency. And you're up, Lisa.
So I have this slide in here because, again, the reason that I got the call was one of your clients was being discharged. And so I wanted to go through the next 2 slides, talk about what are the reasons, because there's only these 6 reasons why a facility can legally discharge a resident. And none of them say that because they're annoying. Well, the first reason is that the resident's needs can't be met there. The second is that the resident has improved. They've done a good job and they don't need the services anymore. The third is that they are a danger based on their behavior, based on their, it can be their medical condition, but it can be simply that their choice of behaviors endangers other residents. They can be evicted if they fail to pay. But there's a caveat to that. And then the final reason that a facility can evict residents is because they've closed. And that actually is something that's happening quite a bit. In the last 5 years, we've lost about 40 skilled nursing facilities. We only have 1,200 of them left. And when I first began doing this work almost 10 years ago, we were at almost 1,200 and like 35, 40. And while a loss of 40 buildings doesn't feel dramatic, when you consider that these are the folk that it's only skilled nursing that accept Medi-Cal payment for long-term care, and there's a growing population of older adults needing that care, the fact that we're having these facilities close when the population is growing, it's very problematic for sure. All right, so I said that the residents, These were the reasons why they can be discharged. And if they're going to be discharged, they have to receive this notice in writing. And there's things that have to be on that discharge notice for it to be a legitimate discharge notice. Sergio started talking about it before, and that often facilities will bully a resident into leaving the facility because they will talk about a change in payment. Medicare does give a notice that says that they are no longer going to be paying for this person's stay or their care. That's right. Medicare will say we're no longer paying for their care. But care has nothing to do with whether they have the right to stay or not. It has to do with payment source. So we'll get there. But I just want you to see this, because this is one of the loopholes that we have been successful in getting people an extended stay in skilled nursing, because the facility failed to provide the 7 specific things on a discharge notice. And they failed to do it in a timely fashion. You can't provide the notice the day you want them to leave. And if the person has been in the facility for a long period of time, say more than 120 days, that notice has to be given for a 30-day notice. And a lot of facilities try and it is very common for a person to get on the naughty list, and then finally they just have one final outbreak that just the facility says we're done, and then over the course of the weekend they give them a 3-day notice of eviction, and just can't do it. That's people can be difficult, but you can't kick them out just because they're being difficult. Okay, so Medicare. Sergio, do you want to jump in on this one? Because I know this is your favorite, talking about how does Medicare determine when coverage ends?
It's only my favorite if they can really take care of our residents and give them that extra additional time they need. And what I mean by that is, before I get into the whole Medicare thing, is that part of the issue, or a big part of the issue, is when residents are discharged from the hospital into a skilled nursing home, they're for the most part, they're still fairly fragile, like very ill still. Maybe they're still recovering from a surgery, or the case might be, because even though we don't oversee hospitals, we only strictly see skilled nursing facilities. And I can't really speak on the hospital, but what I do see is that some hospitals, or most hospitals, which will try to discharge the resident prematurely into a nursing home. And for the most part, most residents may decline, because as soon as they go into the nursing home, they want to start therapy right away, because Medicare right away kicks in, starts the coverage, and for Medicare to continue to pay for the services, the skilled nursing facility has to provide documentation, doctor's notes, their progress on how they're doing, if they're making any progress, whether for speech, physical, or occupational therapy. And as I stated, when residents go into a nursing home prematurely, and because they're still fairly weak, they're not going to make progress right away. So if Medicare continues to see documentation of this resident, and I say Mrs. Jones is my go-to name, Mrs. Jones is not progressing, then eventually Medicare is going to say, well, okay, well then the resident, doesn't need the skilled nursing services anymore, and we're going to stop paying, Well, how do you expect Mrs. Jones to make any progress when she still is fairly ill, or still recovering from her hip surgery? And of course, she's not going to make any progress within the first week that she's already in. And that's part of the issue, is that most residents go into a skilled nursing facility, and the moment they're admitted, they have to do therapy right away, and whether if it's physical, occupational, or speech, and they have to start documenting right away, because Medicare is going to request for those medical documentation on the progress of the resident. And of course, if the resident's not making progress within a 2-week window or so, then that's when Medicare is going to turn around and say, hey, we're going to stop paying. So here's on this date, we're going to stop to pay. And that famous date is when the facility turns around and tells Mrs. Jones, hey, Mrs. Jones, we're going to have to discharge you on this date, because Medicare says we have to discharge you on this date. that famous DC, those two little letters. But in reality, DC stands for discontinued. It doesn't mean discharge, which is where I catch a lot of SNFs trying to, flip the script away in a way of the verbiage and language that's used in Medicare. And then when we step in, it's like, no, Mrs. Jones, that means that Medicare is going to discontinue your services because apparently, most likely, whatever notes that the facility has sent to Medicare is they're showing that you have not made progress and that you, quote unquote, the infamous plateaued, and therefore Medicare wants to stop paying. However, you have the right to appeal to Medicare. You have the right to apply to Medi-Cal. And you cannot be discharged without a proper and safe discharge notice and safe placement. Okay, and safe placement is not a hotel, it's not in the streets, and it's not a homeless shelter. But this is where most facilities try to bully residents to get them out of the facility, and and they will pay for a hotel or a motel to get the resident out of there. So for the most part, when we're involved, we put a stop to that immediately, and we educate our residents of the right. And when the facility sees that my team is in the building and they're working with a resident they try to discharge, their attitude is completely different because they know very well that the residents have the right to appeal to Medicare if Medicare really truly wants to stop paying for their services. And the social services worker has to work with the resident to try to get that paperwork going to Medicare to appeal it. And for the most part, in some cases, they will succeed and they will get approved and they'll continue to get more therapy for them to be to be released into the community in a safe manner. So what we like to call that is involuntary discharge. When the facilities come in to try to bully residents out of the facility. But as I stated, once we're involved, when the residents call us or a family member or whomever reaches out to us for us to step in, the attitude of the facility is completely different because we don't take this lightly. Because this is one of the biggest issues that's rising in our facility, especially during COVID. It was definitely one of our biggest challenges during the COVID times because SNFs had a little bit of that flexibility in the COVID era. Right now, it's tightening up again. The Department of Public Health is stepping in and making their evaluations in facilities and things like that. But ultimately, I personally believe that residents shouldn't, and I don't want to go on a whole spiel here because I think residents should have a rest period before even starting their therapy. And maybe this is something that Lisa and I can talk about down the road and taking it to the Capitol. But ultimately, Medicare is in a rush of trying to get these services and these skilled nursing services to our residents. And ultimately, we just want to make sure that our residents are getting that good quality of care so they can have a good quality of life, so they can successfully go back out in the community. And I have had experiences with administrators that, look, I understand you guys are a business, okay? So in a business, you would want to provide good services, right? Because these residents are your quote unquote clients, right? And, I try to speak their language because at the end of the day, their bottom line is their dollar. But then I try to remind them that this is a human being that you're taking care of. This is someone's mother, grandmother, loved one, you name it. And sometimes I'll go to as far as like, well, what would you do if this was your loved one? Because as our role as ombudsman, we try to paint the picture for administrators in these facilities. And we try to tell them like, well, if you want to continue to receive your so-called Medicare payments and you want to, make your money, I get that. And I understand you guys are a business. But wouldn't it make more sense for you to take a person-centered approach to your residents to ensure that they're getting good quality therapy, to ensure that they're getting good quality of care, so that way they can successfully go back out in the community and have that successful cycle in your facility, so that way you quote unquote won't have another Medi-Cal patient in your facility. So sometimes you kind of have to paint that picture to them. And I've had some success with a couple of my SNFs and within my 7 counties, and my team members are trained to educate the facility staff members and let them know that at the end of the day, this is a human life and they have rights.
You can really hear Sergio's gerontology background start to kick in about the use of therapy, and that people should be encouraged to live the best quality of life that they can get, even if they're older, even if they have even lifelong disabilities. I think also one of the things I would talk about a little bit of when Medicare discontinues, a resident has the right to apply for Medi-Cal. If they are eligible for that, the Medi-Cal benefit, then that can cover their time. But I want to point out one caveat. A facility will ask the resident, do you want to leave? And if the facility says that they want to leave, that's the end of it. And the ombudsmans are kind of stuck. So I would encourage you to, as you're working with your clients, to make sure that they understand that they don't have to leave if it is the right place for them to be. This is an article that, while dated, it's got a lot of really good information for advocates on what are the specific rights and how you can advocate for someone so that they can get medical care in a skilled nursing facility. These two letters, this is the single greatest comment that I'm asked every day right now. Do facilities have the legal right to deny access in a facility? And the answer is no. Facilities are supposed to, federal law, state law says residents have the right to have visits. And if you're hearing of people that are being denied the right to meet with loved ones, being denied the opportunity to leave the facility, please reach out to your ombudsman programs. I know we're running out of time, Sergio, so you've got the last few slides. Take it away.
Sure, I'll briefly touch on my agency, which I am proud to work for, Agency on Aging Area 4. Area 4 funds and monitors programs for seniors in our 7-county planning and service area with the funding of the Older Americans Act. And it's one of 33 agencies agings in California, and is designated by the state to develop and coordinate and fund programs to help older adults maintain their health and independence. So ultimately, my AAA is the focal point to serve older adults within our 7 counties. And as a funding agency, we award the contractor grants to supportive agencies, caregiver programs, legal assistance, health insurance, counseling, of course, ombudsman services, and other programs to meet the specific needs of older adults within their community. And we also serve individuals with disabilities as well, not just older adults. And my program is the only direct service program that's housed under our Agency on Aging.
Okay, so I'm going to stop sharing and maybe we can answer questions, or I know we've kind of hit our time.
Hi, Lisa and Sergio. Thank you so much for that great presentation. We see a couple questions have dropped in chat. We'll take one question and then transition over to Christina and then have a full Q&A afterwards. So let's see here. From Cynthia, how does the skilled nursing facility determine if someone is no longer in need of the services?
You want to go for that one, Sergio?
Yeah, that's where the term plateau that I mentioned earlier, which I strongly dislike that word, but that is our go-to word when they see that the resident hasn't made progress within a week or two. Pretty much within the time frame that Medicare will cover, because remember earlier I said that Medicare will cover up to 100 days, up to, right? That is the word, the lingo. And usually within a 2-week window, if they're not making any progress, then they're going to document that in their notes and send it to Medicare. And then eventually, if Medicare sees that the resident's not making any progress, then they're gonna stop payments overall because the resident has quote unquote plateaued. And regardless, and what I mean by that is regardless if they continue, so when they say plateau, is like if they continue to provide services, the resident's still not getting any better, is pretty much what they're referring to. So that's the verbiage that they utilize in their notes to sell it to Medicare, saying, okay, well then we're gonna stop paying.
Medicare is not, does not pay for long-term custodial care, is the way we're looking at it. It only pays for medical. So if what they need is supervision with dressing and bathing and eating, that's not considered medical care. And so that's not a benefit that's going to be paid for. Next question.
Oh, thank you. So we see that we're at time. We're going to be transitioning over to Christina and then come back to you all as a group. for more questions. CC, I see your hand raised. Please keep it there. We'll come back to you later. All right, Christina, I'm pulling up your slides whenever you're, let me know if you all can see this.
Great. Hello, everyone. My name is Christina Demas-Kahn. I'm the board chair and consultant for California Health Advocates. First of all, I'd like to thank Mika and Lisa for inviting me to this presentation. As a Medicare counselor, I've interacted closely with Social Security Administration as well as the Ombudsman program to assist clients. So it feels good to be here and listening to all this incredible information. However, I'm not familiar with homelessness as a professional, but I am familiar with it as a family member. I have someone really close to me who is dealing with homelessness right now in a different state. And so I'm learning indirectly from a family member who's helping this individual or relative with this dire situation. And so I want to just, thank you for all the hard work that you've been doing, because the information I'm gathering, it's not an easy job. So thank you so much. So today I'm going to give a brief overview about Medicare and Medi-Cal. I'm going to go ahead and turn off my camera, and then I'll turn it back on before we end. So it's a brief overview of Medicare and Medi-Cal, because when you combine Medicare and Medi-Cal together, it definitely takes more than an hour or 2 hours to have a full understanding of each benefit. Even then, it's difficult. Therefore, today's presentation is a brief explanation of Medicare and Medi-Cal due to time restraints. Here's today's agenda. Part 1, California Health Advocates Mission. Part 2, Understanding Medicare and Medi-Cal. Part 3, how to determine what type of insurance someone has. Part 4, who to call for assistance. Next slide. The mission of California Health Advocates is really important. Understanding Medicare and insurance products is difficult. Therefore, it's our mission to provide correct information to Medicare beneficiaries about their Medicare coverage and how other insurance plans or coverage, such as Medi-Cal, coordinate with Medicare. Next slide. During the past 24 years, the mission for California Health Advocates has not changed. Our mission, vision, and values are the same. Next slide, please. And here's our values. It's very long and lengthy, but it's extremely important, because working in the field that we're working in, especially with insurance companies and lobbyists, it's important to keep an unbiased stance. Next slide. Okay. One thing I forgot to say in the previous slide is that California Health Advocates has been supporting the HICAP program with training and advocacy since 1997. The HICAP program is a nationwide program that provides free, unbiased information about Medicare, and it is volunteer operated. So on your screen, you're going to see a Medicare card and a Medi-Cal card. Going to the next slide. What is Medicare? So here is a Medicare card. Medicare is the federal health insurance for people 65 years old or older, some people with disabilities, and people with end-stage renal disease. Please note this is a Medicare card, which is important. If your clients have a card that looks like this in their wallet, then you could assume that they have Medicare. You'll notice on this example card that it says John Smith, and then you're going to see the Medicare number underneath. And also this client has both parts of Medicare, Part A and Part B. This is called Original Medicare. In 2018, the Social Security stopped using Social Security numbers for the Medicare ID number. If one of your clients has a Medicare card with their Social Security number on it, you can call the Social Security number, or you can request a new card online. The same applies to helping a client enroll into Medicare. You could contact Social Security. Please do not call 1-800-MEDICARE to enroll a client into Medicare, because they do not do the enrollment process. That falls onto Social Security. Okay, next slide. So who is eligible for Medicare? We have 4 main categories. The first one is people 65 years old or older. The second one is individuals who are disabled and approved for Social Security Disability Insurance, SSDI. Wendy did a great job explaining what SSDI is. Point 3, people with end-stage renal disease, kidney failure on dialysis. Number 4, individuals with ALS. Next slide. What services are covered under Part A? These are the most common services that I've listed. There are more, but these are the most common services. Number 1, inpatient care at the hospital. 2, skilled nursing care, which Lisa and Sergio spoke about. 3, home health care, and 4, hospice. Next slide, please. For Part B, what services are covered under Part B? Part B is medical, and these are some of the services, not all of them, but the way that I like to look at Part B is outpatient, because these are the services that are not inpatient services, such as being hospitalized or being admitted into a skilled nursing facility care or hospice. So some of the services are doctor appointments, and that includes mental health services, outpatient surgeries, medical equipment, lab tests, ambulance services, diabetic supplies, injections and IV therapies, cancer, and COPD medications. COPD is chronic obstruction pulmonary disease like asthma. I think, of course, I'm drawing blank, but there's 3 other conditions that fall underneath that category. The next slide, please. So this is a snapshot of the original Medicare costs. I did not list the costs because that would take a little bit more time on our part to go through them. But I just wanted to give you a sense of Medicare is not free. Some people have an idea, and I know I did when I started working for the HICAP program, that Medicare was covered at 100% for Medicare beneficiaries, and that is not true. So under Part A, normally there's not a monthly premium, but it's dependent on your work history. Wendy talked about it a little bit, but if someone has 40 working quarters on file, then they normally do not have to pay a Part A premium. But if someone has less than 40 working quarters on file, most likely they're going to have to pay a Part A premium. However, if they're covered under Medi-Cal, then they don't need to worry about that premium. Part A does have a hospital deductible. This year it's $1,484. And there are co-insurances and co-pays for various services under Part A, including skilled nursing care. The first 20 days are free, but after that there is a co-insurance for being in a nursing home. And the same applies for home health care and hospice. So really the only free service under Part A is the first 20 days in a skilled nursing facility care home. Under Part B, there is a monthly premium. It's based on your annual income and your tax returns. They look at your tax returns from 2 years back, but the standard Part B premium for someone who makes under $88,000, or if they're married, $137,000, is $148.50 per month. There is a Part B deductible that begins yearly, and this year it was 203. And for Part B, there is a co-insurance of 20%. Medicare is going to pay 80% when they see a provider that accepts Medicare assignment. So really the only free services under Part B are preventive services and lab tests. I'm not going to really talk about Part C and D. Part C is also known as Medicare Advantage plans, and Part D is the medication coverage, but I just kind of wanted to list it so you could see that even under Part C and D, there are they're out of cost or out of pocket costs. So moving to the next slide, please. Okay, so going to the Medicare enrollment periods. Medicare has enrollment periods similar to employer coverage. While we are working, most of us have coverage through our employers, and they designate a time frame throughout the year for you to enroll in coverage or change your health plan. The same applies to Medicare. These are 4 ongoing enrollment periods throughout the year. Every year, they're at the same time frame, except for the special enrollment period, the last one to the right. So the first one is the Medicare open enrollment period that begins October 15th through December 7th. This enrollment period is for individuals who've already enrolled in Medicare and would like to enroll in Medicare Part D, which is medication coverage, or enroll in a Medicare Advantage plan that includes health and prescription drug coverage. The second enrollment period is the general enrollment period, which starts January 1st through March 31st. The general enrollment period is for individuals who have failed to enroll in Part A or Part B when they first were eligible for Medicare. So for instance, let's say one of your clients was enrolled in SSI and enrolled in Medicare A and B. They lost their SSI benefit because the Social Security Administration couldn't reach them to renew their benefit. Therefore, they lost their Part B coverage because Medi-Cal will pay for their Part B premium. And since they lost their SSI, no one was paying the Part B premium. So Social Security discontinued their benefit. Therefore, they can enroll in Part B during the general enrollment period between January 1st and March 31st, and the benefit will begin July 1st. Then we have the Medicare Advantage open enrollment period starting the same time frame, January 1st through March 31st. This is a time frame for Medicare beneficiaries to enroll into a different Medicare Advantage plan. So if they're currently enrolled in a Medicare Advantage plan and they'd like to switch their plan or terminate it, they could do it during this time frame. And then we have special enrollment periods, which is based on the client's previous insurance coverage. So I created examples or scenarios based on the population you're helping. So an example would be a client went to see a high-cap counselor to apply for the Extra Help program, a program that will pay for a Part D prescription drug plan. In turn, they are granted a special enrollment period to change their Part D coverage once a quarter throughout the year. So that's one example of a special enrollment period. Next slide. Okay, so now we're moving on to Medi-Cal. I do apologize. I know this is quick, but I'm trying to fit within the time frame. And so what is Medi-Cal? Medi-Cal is the nation's public health insurance program for people with low income. The next slide, please. There are 2 Medi-Cal programs offered in the state of California. We have Magi Medi-Cal, and we also have the non-Magi Medi-Cal program. Before 2014, Magi Medi-Cal didn't exist, and individuals under 65 years old didn't qualify for Medi-Cal unless they met certain qualifications, such as a pregnant individual, 65 years and older, or blind. They had to meet certain income and asset qualifications until the Affordable Care Act passed Magi Medi-Cal. Next slide. Here is the differences between Magi Medi-Cal and non-Magi Medi-Cal. To the left is the Magi Medi-Cal program. It's designed for individuals over 19 years old and under 64 years old. It's based on your your Magi, your modified adjusted gross income, and there's no property limits, meaning you don't need to have, your assets could go up to, I hate to say this, but I've seen it, $500,000. I've had clients like that. And then with non-Magi Medi-Cal, non-Magi Medi-Cal includes many special programs. This is the original Medi-Cal program. Persons who do not qualify for Magi Medi-Cal may qualify for the non-Magi Medi-Cal. And here's the eligibility. And it's a lot longer than the Magi Medi-Cal. This is the original Medi-Cal program that existed before 2014. And eligibility is based on whether you qualify because of one of the conditions listed under eligibility and whether your income and assets are below a certain dollar threshold. So for a single person under the non-Magi, your liquid assets have to be under 2,000. And if you're married, 3,000. And it's also based on your income per month. And you're only allowed to have one home and one car. Next slide, please. Questions to ask clients to determine what type of insurance coverage they have on file. So these are questions that helped me as a program manager in the HICAP program for over 13 years, determine what type of coverage someone had on file. Within the HICAP program, we'd get several people calling, not just people over 65, and most of them had no idea what type of coverage they had. And so the first place I would start is ask them, of course, for their name and their information, but their age. And once I was able to get their age, then I was able to narrow down exactly what programs could they be covered under. The second, their monthly income and assets. That was also something that helped me determine what type of coverage they may have, as well as do they have or do they receive SSDI or SSI. Earlier, Wendy gave a presentation regarding SSI, and anyone who is awarded or approved for SSI, they automatically start Medi-Cal. So if someone told me they're on SSI, then I know they have Medi-Cal. So that's just one example. And also I would ask them to look at the cards and their insurance cards in their wallet. And that was helpful. Sometimes we'd have clients walk in and they would show me their cards in their wallet. And then I was able to piece together what they had on file with Medicare or Medi-Cal. The next slide, please. And during my planning with Nika, she had mentioned that some programs with clients that are HIV positive. And so I wanted to include the Ryan White program. This is your local telephone number in Sacramento. This is an excellent program. It's actually incredible. And I just want to share an example. I helped one of my friends enroll in Medicare, and I explained the various options to her. Months later, we met for coffee, and she had mentioned that she was HIV positive and she couldn't afford her HIV medications anymore. I was so grateful she disclosed that to me because I was able to connect her to the Ryan White program in San Mateo County. She revealed that she was paying $1,500 a month for her HIV medications, and she just could not afford that. In a few months, or in a few months than she was on the Ryan White program, actually less than a month, and she no longer has to pay for her HIV medications. So this is available, and HICAP counselors can assist your clients with understanding Medicare and enrolling them into health plans or apply for programs that will pay for their Part B premium and their Part D medications, as well as help them with the Ryan White program. Next slide, please. So I wanted to provide the HICAP information. There is a link on the CHA website, and here is the toll-free number for the HICAP program. I'd like to give a shout out to John Tan, who is the program manager for the HICAP program in Sacramento. And so I would ask all of you to call his office if you're in the Sacramento area for helping your clients. I think Sergio said that he's in the same AAA as the HICAP office. I'm sure that John is the program manager. That's what he was referring to. And if you're interested in learning more about Medicare, you're welcome to call the HICAP office for training or CHA. Next slide, please. And thank you. Okay.
All right, everyone. Well, thank you so much, Christina and Lisa, and Sergio again. I know we went really quickly with both of those sections, but regardless, we learned a lot of, we gained a lot of new content, and at least for me, great refreshers on these topics. I knew very little about the Ombudsman program going into this, and so very curious about the growth in numbers of clients who are under 65, and then also the closing of facilities. And I'm curious how COVID has affected that. And then of course, in terms of getting access to Medicare and Medi-Cal access, I know folks who I've spoken on the ground have had questions around these and how they can better get connected. And so I have seen some questions being dropped in chat, and then folks also submitted questions at registration. So I'm gonna pull those up. But before we dive into those, I did want to grab Cece again, because I know she had her hand raised earlier. If you don't mind going unmuting yourself, Cece, please feel free to voice out that question.
My question was answered at the end of the presentation.
Okay, great. Let's see here. Another one from Cynthia. Can someone call the HICAP number and get the help to decide which Medicare program to select or would be best for them?
Yes, this is a great time to call the HICAP program, especially if it's for someone who is already enrolled in Medicare, because then they could change their plan during the Medicare open enrollment period. Because once the enrollment period ends, then they're locked in to their current plan unless they have Medi-Cal or they're enrolled in Extra Help. Because if you're enrolled in Medicare or Extra Help, then you'll have an ongoing special enrollment period throughout the year. But if the client does not have Medi-Cal or Extra Help, then they're locked in. They're not allowed to change unless they're enrolled in a Medicare Advantage plan. Then they could change during January 1st to March 31st. Hopefully that answered it.
We have another question here from Tina. What can we do to change landlords who won't accept anything less than perfect credit? Who is that? Tina, if you're on, please feel free to add on to that question. we'll bring up another question here. Let's see. From Christy here, what to do when individuals are hospitalized and can't be held due to placement? Open it up to Lisa, Sergio.
Well, the Ombudsman program does not have the jurisdictional authority over hospitals other than that a distinct part of a hospital that does long-term care. So I can't answer that question, how do you find placement after the hospital is evicting you? So
usually, in my experience, it's the social worker's responsibility at the hospital to find placement for them, whether if it's another long-term care facility such as the assisted living or a boarding care home or a room and board, which is the lowest cost for to have a roof over your head. So ultimately, in my experience, it's usually the social workers at the hospital that do the placements for patients in hospitals.
And then we had a question earlier from Christina. Does this apply to hospitals? Also, I believe that was during the Ombudsman portion. I hope that answers the question, but Christina, if you had any other questions or follow-up questions, please feel free to unmute yourself.
No, I think it got answered. Thank you, though.
All right. I'm trying to scroll through our chat here just to make sure I didn't miss anything. Let's see.
Well, while you're doing that, I did want to jump in with, if someone knows of a person needing ombudsman advocacy outside of the Sacramento area where Sergio covers, if you go to the California Department of Aging and you type in their search about the local long-term care ombudsman program, they will provide you with a link for any one of the 35 programs across the state. So it is a service that's available to everyone, regardless of what county they live in.
Thanks, Lisa. And if you have any questions from the top of the call to all through our Medicare, Medi-Cal programs, please feel free to drop them in chat or use our hand raise feature. We'll call on you. I forget whether we were able to address this question. This one is from Maryland. Who continues to pay for the care once Medi-Cal is no longer paying for their stay?
Well, as long as a person is financially eligible, meets the Medi-Cal requirements, and they meet the requirements, those 6 reasons, they do have a need for the service. They have not gotten better to where they don't need to be there. They are not a danger to themselves, and being in the facility is not a danger to them either. Then Medi-Cal will continue to pay. If, however, they are not financially eligible for Medi-Cal, I mean, that happens. We have people that have savings, but they don't want to spend the savings on skilled nursing because at $600 a day, a lot of older adults are like, nope, I don't want to pay. So the facility may attempt to get the person qualified under Medi-Cal, but if they're not eligible and Medicare no longer pays for it, then that was one of the legal reasons why they can give you a discharge notice. But as far as the question, who pays if Medi-Cal stops paying? No one. That's kind of the problem here.
Unless they're prepared and have long-term care insurance, which is very, very rare, not that many people invest in long-term care insurance, or they're well off and are able to pay the bill, which that's also rare. But ultimately, for the most part, if they do qualify for Medi-Cal, then Medi-Cal will take over and continue to pay. However, there is a catch. They take all of your Social Security except for $35, which is something called the share of cost. So if you do qualify for Medi-Cal and you remain in a SNF, then you're custodial care, and Medi-Cal will pay for your stay, and then the facility will also take all of your Social Security check except for $35, which is your monthly allowance, which, yes, it is ridiculous, to only have $35 a month to survive off of. I know that, and I think it's been at the Capitol before where they tried to increase it and they went out the window. But anyways, but that's overall everything in a nutshell there. For a resident who does not qualify for Medi-Cal and is on the verge of being discharged, the facility is still obligated to give a 30-day notice of discharge and try to find some form of placement, try to discharge the resident into a safe environment. And if that does not go as planned, then down the road to the extreme measures, then that's when the facility will consult with their legal team, get a court order, and then force the resident out of the facility. And then that's when law enforcement will come in, take the resident, and ultimately they'll just dump them off at the nearest hospital. So that's, you know, when it's down to the nitty-gritty.
Thanks, Sergio. We have another follow-up here from earlier. What about, I think this is directed to Christina. What about applying for Medicare? What age are you supposed to apply for it?
It was designed for people who are retiring, so 65. And so people are eligible if they have a disability. So that could include SSDI, because once they're approved for SSDI, depending on when they file their application, but normally it starts in 24 months after they're awarded SSDI. Sometimes they backdate it, which I'm sure Wendy could talk more about, but you could backdate your coverage. So if they backdate it, it's possible you could start right away. And then if you're, if you have kidney failure, end-stage renal disease, then depending on whether you have 3 months of dialysis, you could start right away. And then you could qualify due to ALS. Those are the 4 main reasons for being eligible for Medicare.
And then for Wanda, what should a client do if they get an inheritance and they have SSI? If you're still on, or your colleagues. Juan, are you still there? You're on mute if you're speaking. We'll come back. Let's see here, another one. Can someone talk about the waiver available for low-income individuals who want to enter into a SNF or assisted living facility but can't afford it?
That the ALW, so the assisted living waiver, it is a pilot program. It does utilize Medi-Cal funds to pay for Medi-Cal eligible individuals to live in a less restrictive environment, which could be assisted living or even at home. This program is only available in 15 of the 58 counties. It is not a program that I talk much about just because there's always a wait list. When I worked in an assisted living facility, it was more common for a person to die waiting on the wait list than to actually ever get to utilize the program and move into an assisted living facility. The idea of it is that if a person is in a skilled nursing facility, that's costing Medi-Cal a higher dollar amount than if they could live successfully in a lower level of care. So rather than paying the $180 to $220, Medi-Cal could pay less, say $100 a day. So that would work as a cost savings to the state as long as the individuals were previously in skilled nursing and the state was putting out that money and now they're putting out less. But another aspect of that program is that people who are currently living in the community, so maybe they are in another assisted living facility or they're at home and they have run out of funds, then this program is supposed to make a percentage of those folks eligible to go straight from home into assisted living. The practice is that's just like finding the Willy Wonka golden ticket. It's very, very difficult to do. It is more likely if your county has providers that are willing to participate, that you go from a skilled nursing into assisted living. But when we talk about 15 counties participating, I think it's really disingenuous. For example, Sonoma County is one of the 15 counties that's available to participate. But they only have 2 providers that have a total of 12 beds available. So there's only 12 people in Sonoma County that would be eligible to utilize this benefit. So you can see how there would be a really long waiting list to access it. But it is an option. It is something that the advocates go back to the state legislature every single year asking that the Department of Public Health allocate additional funds into the program to address the wait list. And they've done that. In July, they added enough money to eradicate about 4,000 people on the wait list. But my understanding is the challenge is we have more people needing the program and fewer providers willing to provide care at that lower rate. The average assisted living daily rate is somewhere around $150 a day, and significantly higher if you're providing memory care. So it's hard to find a provider willing to accept a person that has very high needs, because chances are they spent a long time in a skilled nursing facility and then got better, but they're still pretty fragile. But yes, that is a Medi-Cal program that is available. And you can go to the Department of Public Health's website and look to see if you're in one of the 15 counties. And yes, Sacramento is in one of those counties. So maybe Sergio, you can speak to the number of facilities in Sacramento that are on the program.
I don't have the exact number because I recently had a facility that opted out. Again, the key term here is participate. They're not enforced to kind of, participate in this program. So I don't have the exact number of beds in my area, but I know that we have a very, very huge waiting list as well for residents that want to get out of a SNF and go into a lower level of care as assisted living.
Thanks, Sergio. We have another one from Marcy, who's asking about what about chronic homeless folks being discharged from the hospital with chronic illnesses and have nowhere to go? Chronic homeless defined as persons who experience homelessness for at least a year.
Part of that is you can't make a person go into a nursing home. So if they're in the hospital and they're being discharged, the hospital, the California Department of Public Health back in 2016 did state that discharging to a homeless shelter is considered a safe discharge if the older adult at any time in the past was homeless. And so it's just a cop-out. But Sergio said it at the beginning, these facilities are in business to make money, and we have to find additional placement so that individuals can leave facilities and go into secure housing. And so that was my hope, that by partnering with you, you would be able to help us identify housing options for these adults that are being discharged from the hospital or a skilled nursing facility. So it kind of makes me sad to see the housing advocates asking the question about chronic homelessness. That is a growing problem.
Yeah, especially right now because it's fall. We're going to start to see a trend of homeless individuals in skilled nursing homes, and they will remain in a nursing home until about spring, and then they'll go back out into the streets again. I've encountered many residents in the field where they're on the verge of being discharged, but they know that they can't really be discharged without them consulting with their legal team after a 30-day notice, which means that buys them an extra 30 days to be in the facility and get 3 meals a day and a roof over their head. And then once the rain's gone and the weather's better, then they're back out on the streets again. So we also have that trend. But I can sit here and tell you that I have yet to encounter a resident saying that I want to spend the rest of my life in a SNF, because for the most part, most residents that don't have the resources, don't have the income, they end up living in a skilled nursing home for the rest of their lives because of the housing, and because of the program that has a huge waiting list, like as Lisa stated. So I have yet to hear anybody say they want to spend the rest of their lives in the SNF, but that is what we're seeing now, is that the most people, because of their social economic status and lack of resources and family support and all that, that they end up living in a SNF for most of their lives.
We do have another question here. How can a senior be placed into a higher level of care if they don't have the income? Anyone want to comment on this? Yeah, go ahead.
So let's say you have a person that is living independently. They're on their own, and it's just not safe. They can't stand long enough to go to the grocery store to purchase the food. They can't stand long enough to prepare the food and then to eat the food and then to clean up after themselves. So they do in fact need activities of daily living, but maybe they don't have the $3,000 to $4,700 a month average to pay for assisted living. What we're finding is that there's just more and more older adults that are falling into self-neglect because they don't have those kinds of resources. As Sergio said, very few people purchased long-term care insurance. It's very expensive. Most people believe that their Medicare benefit is going to cover them. I can't tell you how many times my phone rings with frantic people being faced with discharge because they just assumed that their Kaiser benefit would cover mom. She broke her hip, she can't go back home. Well, it took her longer than those 20 days to recover. So she's just not eligible for Medicare anymore. And we're seeing more and more individuals that are agreeing to discharge, agreeing to an unsafe discharge because they just don't have the money, or they don't want to spend what little they have of their savings account. They don't want to apply for Medi-Cal because they don't want to have their home to be a part of a clawback. But fortunately, some laws are changing, so that's not going to be a problem moving forward, but we have seen that in the past. So the question of how would you help get a person into a skilled nursing facility on Medi-Cal? Truly the easiest way is to wait for an accident. If you go into a hospital and you are in the hospital, you are admitted. You're not in observation, you're not in the emergency, you're actually admitted into the hospital for 72 hours, not including the day you were admitted, not including the day you were discharged. And then you transfer into a skilled nursing facility. Under those criteria, your Medicare benefit will pay for that the first 20 days. And then after you're in the building, the person can then apply for Medi-Cal to pay for long-term custodial care, and they can stay. That is historically the easiest way I have found of getting a person into a higher level of care. And it's really, truly tragic because it's all dependent on waiting until someone has an illness that warrants that extended period of time in a hospital. Now, if there's a tin lining to COVID, because I really can't say it's a silver lining, but if there's any good news of COVID, right now, that 3-day or 72-hour requirement has been lifted. So if an older adult finds themselves in a hospital, admitted into a hospital, then they can transfer into a skilled nursing facility on Medi-Cal, even if they haven't been there for the 72 hours. But I don't know how many more months we're going to have that option.
Thanks, Lisa, on that COVID note. Christina, this one I believe is for you. What are some avenues for clients whose mental health is so severe that they cannot follow through with mental health appointments and have no medical records?
That is a tough one. I would reach out to your local county mental health system. That's what I've done in the past. In San Mateo County, we have various nonprofits like Kaminar, that is a mental health organization, excuse me, that provides caseworkers, and they really assist the client, the mental health client, excuse me, with following through on their appointments. And in turn, they work with HICAP to get the Medicare information they need. but I would reach out to your county mental health system, because normally they have caseworkers that do the same thing, and they assist the client with various issues, including appointments and health coverage. So that would be my recommendation. On the HICAP part, HICAP counselors are able to gather information about clients. And so that's easy for us, but it's just getting the client to contact us or their caseworkers so we could assist them.
Thank you, Christina. So before I let you go, I just wanted to open up the floor again to see if there are any final questions for our lovely presenters. There's been a lot of really great information that's been shared today. And so I just wanted to give a final chance here since we have all our presenters.
I have a quick question.
Yeah, hi, John, go ahead.
Hey, maybe for Sergio, maybe for Lisa. If we have someone who has power of attorney, both financial and medical, and have someone that has, let's say, moderate dementia, and they're actually in a home, and you suspect that there's a challenge, don't they have the rights, or what rights do they have as far as going in and getting the records, the case files, nurses' notes, doctors' notes, and everything else, so they can review those? Because as that person, as I understand it, if they have that power of attorney, they are that patient's legal agent.
You're 100% correct.
Okay, so is there a particular state or federal law that gives the person the right? I've heard of people being denied the right to case files before. It's ridiculous to me, but
the first thing I asked, does the facility have a copy of the legal power of attorney on file? Because most facilities, in my experience, the reason why they deny that is because they don't have that on file. So when my ombudsman team steps in, they help assist with the POA to make sure that they provide a copy to the facility staff, and then we educate them that because that's the next of kin, that is a legal power of attorney, both health-wise and financially wise, they have the right to access their medical records.
and they all know this anyway, right? I mean, it's just common knowledge. They just
Yeah,
want to.
yeah, it is. For the most part, most facilities, they how can I say this in a polite way? Help me out here, Lisa. I'm really trying to.
They want to deny you your rights.
Facilities will attempt to bully families as much as they can. Then they.
There you go.
They just that. I mean, I'm not exactly sure why.
Well,
I think is going to be gained from it. But as far as the legal right for it, if you're looking for a regulation, if you just Google resident representative powers of in a skilled nursing facility, you can find the health and safety codes, the federal codes in the Older Americans Act that can provide you a lot of information. You can also look on the California website, the California legislator, leginfo.com, under health and safety codes. And so it's listed there. Most of the time I have found just reaching out to the ombudsman, and the ombudsman will make a phone call.
Yeah, in my experience, that's as soon as we're involved, their attitudes are completely different, and they tend to be more in compliance of working with you. But I hear what you're saying, because for the most part, when they try to bully families, it's because, one, maybe they're not documenting like they're supposed to, and they're trying to sweep something under the rug, and they're trying to buy themselves some time to make sure all the records are in place before they provide you with a copy of it. And it's really difficult for us to, determine if they're falsifying documentation, because we need consent to look into the files ourselves as well. Because if we get permission from the family member to look into the files ourselves, we can do that. But at the end of the day, because we're not a regulatory government agency or anything like that, that we can't really enforce the statutes or regulations. We can educate them about the statutes and regs, and then have them work with the family members. And for the most part, they start to comply. And but ultimately, as Lisa stated, it's another bullying tactic that they utilize to, maybe because they're trying to cover something up.
Yeah. Okay. Thank you, guys.
Thank you all. And so before I let you all go for the day, I did want to share some quick updates from SSF's end. The NOFO applications are being finalized for submission next week, and we're now ramping up our planning for the point-in-time count, which is being slated for the final week of January 2022. We're still working out the dates and other logistics, but at this time, if you and your team are interested in volunteering with us, whether to canvass or to take on any other activities, please complete our volunteer sign-up form. I will share that in a follow-up e-blast. Session materials from today will be uploaded to our website where previous sessions are also currently available. And then if you are free tomorrow afternoon at 2:30 p.m., we are hosting another session focused on creating employment opportunities for our homeless community members. And so that registration info is also on our website. Lastly, please take our post-discussion survey, which I've dropped in chat a little bit ago. That will just let us know how we're doing on these trainings. And another final reminder, we are planning to put out another survey for the larger community in the coming weeks to help us identify which topics to prioritize for 2022. And so these post-discussion surveys have been very useful to help us make sure that we're addressing topics that are most relevant to you and your work. And so we do appreciate all of you. And with that, I wish you all a lovely afternoon, and thank you to our lovely presenters as well for the very informative presentations today. And with that, we adjourn this session.
Thank you.
Thank you.